Here's some background. Japan is a super-aged society with the highest proportion of elderly individuals in the world, and it's expected to exceed 30% in 2025. Metropolitan areas such as Tokyo have a rapidly increasing population over the age of 75, which may put strain on the healthcare system. In addition, the proportion of single-member elderly households is increasing, partly due to the trend towards a shrinking family size, which means that the safety net of family care for the elderly is under strain. In addition, living alone and poor social support have been associated with depressive symptoms in the elderly, and these may be exacerbated by social isolation due to COVID-19. Currently, 4.6 million people in Japan are living with dementia, and this number is expected to double by 2025. As a result, Japan enacted the New Orange Plan, which is a community-based approach centered on 7 pillars that emphasize the viewpoint of the patient and their families. In a study by Kim et al. In 2017, elderly people who received community-based care had increased cognition and lower rates of depression. Currently, there's a shortage of geriatric providers in Japan, and only 30% of Japan's medical schools have a geriatrics department. Increased exposure to geriatrics will increase the interest, according to a study. In addition, the role of technology such as apps can be used to improve the convenience and lower the costs of healthcare delivery to the elderly population, as well as alleviate some of the symptoms of social isolation.
We designed a program named Umaru, which means collaborative effort in helping each other. This is reflected in our logo and our slogan, giving a helping hand to promote healthy minds. Our goals are 1, to improve elderly mental health, and 2, to increase student interest in geriatrics. Participants are seniors 70 and older, living alone. Facilitators are medical students during year 2 to 4 of school, and monitors are physicians. This is a 5-year pilot project in the prefecture of Tokyo with 15 medical schools. A new cohort starts yearly, with seniors consulting their physicians to join the program via Japan's mandatory public long-term care insurance that provides benefits for those over 65. Then, med students are matched with a senior to work with during their 2nd to 4th years of school. During this time, students meet with seniors regularly to focus on 3 evidence-based topics that promote mental health: companionship, exercise, and cognition. We developed an app for student use that facilitates these activities and measures program impact. Meetings are in person, but a virtual option exists on the app for COVID-19 flare-ups mandating social distancing. Program themes differ per year, with year 1 being activity exploration, year 2 creating routine, and year 3 enrichment.
The impact of our program can be measured by 2 questionnaires. The first questionnaire will be given to the seniors to assess their mental health and dementia progression. The questionnaire will be administered by the medical students before the program begins and then biannually. The questions evaluate the seniors' independence, happiness, pain, and memory. To answer the questions, the senior participant will be asked to rate their answer on a scale of 0 to 5, with each number representing a different answer. The exact wording of the questions and scoring of the answers can be seen here. Our hope is that this questionnaire will show an improvement in the senior's overall mental health status. The second questionnaire will be completed by the medical students before beginning the program and then biannually. Our hope is that this program will make medical students more aware of the issues faced by elderly patients and increase their interest in pursuing a geriatric specialty. Shown here is a list of questions and the numerical answer scale. Our pilot program will run for 5 years, helping approximately 8,250 seniors.
The success of any intervention lies in its ability to be culturally relevant. Thus, we are targeting cognitive and physical domains that decline with age with activities that are already culturally very familiar. Our intervention draws on the core cultural value of caring for and respecting the elderly. All our companionship activities, like interviews and reading literature together, are designed to help the senior reflect on their lives and feel a sense of purpose. On the cognitive side, an example is the word game Shiritori. In this game, a player has to come up with a word that starts with the last letter of the previous word. So if I say happiness, you could say sword, to which I could respond dance. Jumping like this between words improves semantic memory, attention, and primes connection between words. An example on the physical side is Radio Daiso, a popular Japanese radio broadcast warm-up exercise routine done daily. Doing this with a student allows the exercises to be modified as necessary and holds the senior accountable. Finally, manual dexterity is an important skill that declines with age. Practicing sand painting and origami, drawn from the rich Japanese aesthetic tradition, improves attention to detail, focus, and manual dexterity.
Each senior has their unique identifier number for the medical students and healthcare providers to track their progress. The app easily allows you to call or video chat with the elder. Each year of the 3-year program requires 7 community visits per year. The companionship visit is meant to build a relationship between the student and the elder by encouraging them to visit dementia cafes, scenic Japanese cherry blossom locations, and to focus on getting to know their senior with thoughtful conversations. At the end of every session, the student should complete the feedback form with details about how the session went, as well as areas to focus on in future sessions. The students also need to complete the biannual Elderly Mental Health Questionnaire and the Medical Student Geriatrics Interest Survey after the first and last session of the year. The exercise visits encourage students to help the elderly live a more active lifestyle by utilizing local resources such as outdoor public exercise parks. The cognitive visits encourage the medical students to help the seniors remain mentally active, and they can use the app to request resources such as puzzles. The 4th session requires the medical students to create a group and hold a tea ceremony to allow the elderly members in the program to meet one another. Lastly, the medical providers of the elderly person in the program can use the app to check on the progress of both the students and the elderly, and the app allows the medical provider to contact the medical student if necessary.
Challenges we anticipate include having more seniors than we can serve. Right now, we're targeting seniors who live alone and putting other seniors on the waitlist till the program expands. We also realize that seniors will need long-term companionship even after the program ends, as aging is progressive. Thus, our plan for sustainability is to expand the program to include nursing students and to recruit and train high-achieving high school students to provide regular check-ins and companionship.
So, how much does this cost, and how do we plan to pay for it? Our budget is $2 million USD. Application development for web, iOS, and Android is estimated to cost $108,000 upfront. We plan to hire a developer for app upkeep at $90,000 a year, a data analyst to evaluate user-submitted data at $60,000 a year, and a marketing associate to handle sponsorships at $50,000 a year. This brings our 5-year total to $1,108,000, which is well below our $2 million budget. Since medical students will be interacting with their elderly population, this allows us to operate with a small team doing app maintenance, data analysis, and marketing. Since we came in under budget, we have room for team growth if necessary, regular wage increases, and benefits. And we plan to utilize sponsorships. We plan to partner with local businesses to attain vouchers for events like tea ceremonies. We plan to organize senior discounts with associated businesses like gyms and personal care businesses. And we plan to acquire materials like puzzles, origami, and painting supplies via donation from corporate partners, and this will all be arranged by our marketing associate. This makes all our activities accessible and not cost prohibitive.
Umaro provides innovative tools on an easy-to-use platform that will enhance elderly care and quality of life. It provides seniors with numerous community resources, geriatric clinical experience to medical students in their preclinical years, and provides key updates to physicians on their patients' day-to-day living. This last feature is especially unique as it allows physicians to discern subtle changes in their patients' lives, which can potentially illuminate a pathology before it becomes unmanageable. In summary, Umaro aims to both help seniors in this current moment and increase the number of geriatricians in the future, giving a helping hand to promote healthy minds. Thank you.